Hello, this is Susan Knowles from Cochise College Nursing, and welcome to this podcast where I'll briefly discuss the extremes of age in pregnancy. Is she too old or is she too young for pregnancy? Please also take advantage of the video clips that I've attached to this podcast where you'll be able to explore just some of the thoughts and feelings that go on with the teen mom as well as with the older mom. Thank you. Kids having kids in the United States seems to be going down a bit. However, the United States still has more teenagers having kids than in other countries. Kids having kids tend to be poor, they have less opportunities, and history tends to repeat itself. In other words, not only do they go on to have another child within 2 years, but also children of teen mothers have a higher incidence of going on to have children as teenagers too. The children of teen mothers tend to perform about 1/3 lower than other children do. They have an increased risk for preeclampsia, and the reason for that is unknown. However, there was a study looking at both obesity and teen preeclampsia, and it was found that in those teens that were extremely overweight, they tended to develop preeclampsia 4 times more often than their peers. Teenagers that are pregnant tend to be anemic. They have a higher incidence of preterm labor and low birth weight. And we think that's attributed to their poor diet, as well as poor perfusion related to either having preeclampsia or the underdeveloped vasculature of the younger pregnant woman. They have an increased risk of having a higher mortality rate as well as cephalopelvic disproportionment. And that may be too also from being a younger woman. They tend to have an increased risk of being in an abusive relationship, developing or experiencing sexual abuse as well as depression. They have an increased risk for sexually transmitted infections. They tend to be more often smoking and to abuse drugs. They also tend to start prenatal care late, or they have intermittent prenatal care, and we think that's related to the denial of the pregnancy, lack of knowledge of how, when, or the importance of prenatal care. They are at risk of having poor parenting skills related to their immature level of knowledge of parenting, as well as unrealistic expectations for children or babies. And again, we think this is related to their cognitive development. To prevent unintended pregnancies in the teens, we need to teach them how to set limits for sexual behavior. And it's especially important for the younger teen who may be pressured into becoming sexually active before they're physically and emotionally ready. The nurse that is planning a health promotion lesson for a group of pregnant teens should include in the teaching plan how to choose healthy foods, and maybe work with them in tailoring their diet to the foods that they like as well as the ones that are good for them and the baby, and to help them to understand why eating a healthy diet is important. They need to learn about what to do when the baby just won't quit crying, or in other words, parenting skills. How to identify the signs of preterm labor, and we've talked about this for all women. But because we know there's a higher risk in the teen mom, we need to make sure that we repeat this information frequently. If the teen is still sexually active and maybe changing partners and thinking that they're safe because they're already pregnant, so they can't get pregnant again, but we need to remember that we need to tell them about prevention of sexually transmitted infections. And now we all know the importance of not getting a sexually transmitted infection when you're pregnant, because we know this increases the risk of premature rupture of the membranes and premature delivery. And teens are already at risk for this. We also need to stress the importance of learning how to deal with stress, especially after delivery. We need to teach them about, well, perhaps not teach them now, but actually encourage them to attach to the baby while they're still pregnant. And maybe we can do that by having them hear the fetal heart tones, by doing ultrasounds so they can see the baby, they can see fetal movement, they can feel fetal movement, and discuss fetal development using diagrams and maybe a DVD rather than written materials. And then we can judge those written materials based on their cognitive level. After delivery, we need to teach them about the baby cues and how to care for the baby and realistic expectations for a baby's behavior as well as parenting techniques. And if she has appropriate family support, they can really help her with learning about the realistic expectations for a baby. And if they don't have good family support, then we as nurses need to make sure they have some sort of social services, and if possible, get them into an adolescent program. It's not unusual to find that the father of the baby drifts in and out of their life, or maybe out of their life altogether. If they are in the teen's life, then it's important to include them into the teaching plan so that they can learn about realistic expectations for this baby. It's often difficult for them because they too, if they're around the same age as the teen mom, lack education and employment opportunities, and they oftentimes cannot seek or maintain those employment opportunities that are good enough or high income enough to support this young family. Now let's contrast the teen mom with the mother who decides to delay her pregnancy until after the age of 35, where we call this advanced maternal age. And it's different because oftentimes women that are older have decided to postpone their pregnancy because they're in a career and they want to push it off until later, thinking someday they'll have a baby. But what happens is, as they get older, it becomes more difficult to get pregnant because of the aging ovaries. However, because of technology today, many women can become pregnant with the help of infertility testing and infertility devices or treatments. She may have more difficulties in her pregnancy if she has medical problems already that are existing. So she needs to get those under control before she becomes pregnant, if at all possible, and those need to be addressed during prenatal care. She also is at a higher risk of developing genetic abnormalities, specifically Down syndrome. And so again, genetic testing is important. This may increase the stress of the pregnancy, waiting for those test results, and knowing that she's at higher risk of that. She also may be at risk of already having pre-existing gynecologic problems like uterine fibroids, because this can cause her to go into preterm labor because of the added size of the uterus. Older moms usually come into prenatal care with more resources than the teen does, but she still may not be prepared for the increased energy levels that are needed after delivery, as well as in their first few weeks after delivery. They tend to have less support from peers or from grandparents, depending on their age, and even if grandparents are still around. But they're usually more open to all the learning opportunities. They ask a lot of questions, whereas teens tend not to ask questions. And they tend to seek out any learning opportunities, specifically childbirth classes. And they're more receptive to the written materials than the young teen would be.